Good afternoon, everybody. I am Dr. Kavita Shah. I am a gynecologist and I run my hospital, Star Hospital and Kavita Hospital at Surat. I am Surat-based gynecologist. My hospital is Star Hospital, which is located at Ring Road, Civil Charista, Surat. Now, today, my topic of discussion with you, friends, is importance of double marker in pregnancy. Now, there are a few important investigations which are needed to be done during a first 3 months of pregnancy, that is, first 12 weeks of pregnancy, which will help us to know whether the baby the lady is carrying is having any genetic abnormality or not. A few investigation will guide us out in order to know that we have to move further with investigations or we don't have to move further with investigation. So one of the tests, apart from the routine blood test which is done in first trimester pregnancy, that is the CBC, is the complete blood count, the blood group of the patient, the random blood sugar of the patient, the thyroid TSH hormone, that is self-stimulating hormone of the patient, the triple L, that is HIV, HBs, gene actually, these are the viral markers which is important during pregnancy. Basic urine routine examination. Apart from all these basic investigations, there is one important blood test which needs to be done during pregnancy in the first 3 weeks. It is mainly done between 10 to 13, 11 to 13 weeks. Is between done between 11 to 13 weeks. That is known as the double marker test. This double marker test, what is this? What is its importance? That we are going to discuss today. Double marker test is a blood test to be done between 11 to 13 weeks. It is a test which will help. It will help us to know whether the baby is genetically normal or not. So before going on to double marker test, I would like to tell you about something about NT-scan. What is NT-scan? NT-scan is nuchal translucency scan. Nuchal translucency means it is a sonographically the baby is seen radiologically USG on USG between 11 to 13 weeks, and the thickness of the skin behind the neck of the baby is measured, which is called nuchal translucency. And this nuchal translucency should be less than 3 mm. If it is more than 3 mm, then it will suggest that you need to do further workup of the baby to rule out whether the baby is genetically normal or not. So first thing that is to be done between 8 to 13 weeks of sonography is the nuchal translucency, and it is also called an anti-scan. Once we get the anti-scan, the patient with that anti-scan report goes to a laboratory for blood checkup. Here the test called double marker is drawn. That is, a blood sample is taken for double marker, and that the what is double marker? It is analysis of two hormones, that is beta HCG and PAP A. And when after 3 days to between 5 days to a week, you get the report of the double marker. If the double marker shows low risk, it's or low risk means it is the double markers are normal, the blood values are normal, and the patient need not worry, and that pregnancy can be moved forward easily, safely, without any much stress. So, when we take the report of this double marker, we find that the laboratory gives us the inference. The inference could be either it is high risk and positive form, double marker test, or it is low risk, or we can say it is negative for the double marker. If it is negative for the double marker test, if the NT is less than 3, nothing to be done, forget and move ahead. But if NT is more than 3, as well as double markers suggestive of high risk pregnancy. What is this risk? Are the women? Uh, For this double marker, the age of the women is also important because all this discussion is about a genetically abnormal baby. Now, what sort of genetic abnormality to expect in a baby as the mother and the father age goes about 30 to 35, and that is Down's syndrome. Mongo babies, which many of you might have seen in your surroundings or be there in your family. The, those babies are the babies with eyes like a small Chinese like eyes, low placed ears, and these babies are mentally retarded. What is mental retardation? Because they are not growing at the pace they should grow, and they are not going to be they are not going to grow up with individuals with good intelligent quotients, this IQ, and they are going to be dependent on the family lifelong. And apart from mental problems, they might be having any renal kidney problems, heart problems, may be associated with insect babies. And in this world, which is very expensive to stay in, it is very difficult to bring up a mentally as well as physically disabled child. So this is a very important test which will guide the patient and the doctor whether this pregnancy the patient's carrying should be continued till delivery or it should be terminated. So once the test result comes positive and echotransparency is more than 3 mm, test result is positive. The age probability of the patient is more than 30s. Patient is between 30 to 40, 30 to 45 years old, and then that they which needs further investigation. If it is between 11 to 13 weeks, you can go in for choriomedular sampling, that is sonographically a small tissue chorion sample, that is the tissue of the placenta, is taken and sent for genetic analysis, microarray, or uh, the fluid around the baby, which is called the amniotic fluid, is taken and sent for testing for genetics microarray. And if the genetics microarray report comes out to be normal, nothing is to be worried, the pregnancy can be continued. But if the genetic array turns out to be trisomy 21, then that is suggestive of Down syndrome. Now, what is trisomy 21? All individuals, that is every human being, if you call animals, birds, are made of a genetic material. And for humans, the genetic material consists of 46 chromosomes. And we don't have one more chromosome or we don't have one less. If there is one more chromosome on the 21 number channel, then the baby, then it is called trisomy 21. And those babies who are born having this type of chromosomal configuration are babies of trisomy 21 or Down syndrome. And as I told you, the Down syndrome babies are not only genetically abnormal, but they have mental impairment, they may have heart or renal problems, and many multiple problems. And then they are the babies who will have to live a dependent life till they live. So, by the help of this double marker test and a nuclear translucency test, such babies can be identified between 11 to 13 weeks, that is 3.5 months. If it turns out to be such trisomy 21 babies, then it can be easily terminated The babies can be easily terminated, and such a dependent baby, a genetically abnormal baby, coming into this world can be avoided. The 11 to 13 week scan time is missed, and double marker test is not done. Then from 15 weeks to 20 weeks, quadruple marker test can be sent for examination, and that can also be interpreted in the same manner as double mark. Practically, I have given you all the details of what is a double marker test, what is its importance. Now, to whom it should be advised. Mothers more than age of 32 years, families free of history suggestive of such baby in the family, or the patient has conceived after a IVF. It is an ERT, that is artificial reproductive pregnancy, that is a test tube baby, or the mother is having diabetes mellitus. So, in such cases, double marker test should always be done. Most important is the age, because now the female and are have moved out of the house, they've become working women, and hence they've been delaying their pregnancies, and now they get their first pregnancy, second pregnancy in their early 30s, and are at risk of delivering such uh, babies who are mentally impaired as well as physically impaired, and that can be ordered by a simple blood test and sonography 11 to 13 years. Now we will go in for answering the question which my followers have been asking me during this live session. So, good afternoon, everybody. Now, my first question is why by Lakshmi Mishra, and she's asking me why is a 12-week scan important? And the second question is how accurate is a 12-week scan? Third question is can you see abnormalities at a 12-week scan? So now I will answer all the three questions together. As I told you, a 11 to 13 week scan is very important because of few genetic abnormalities or few neural defects, that is the defect in the spine, in the spinal cord formation problems can be detected between 11 to 13 weeks. So 11 to 13 weeks scan is very important radiologically as well as blood test wise, in which you get a double marker test done, and how accurate it is. It will identify genetically abnormal babies by 70%. Yes. Can you see abnormalities at 12 weeks? Yes, definitely. A few abnormalities like anencephaly, there is no head in the baby, no skull bone formation in the baby, spinal cord, spina bifida, there is spinal cord abnormalities in the baby can be identified between 12 weeks scan. Now, Lakshmi Mishra, your other question is why does a heart stop beating? See, there are many reasons for the heart stopping beating, and important is if the baby is genetically and physically normal, then the baby's heart usually uh, the baby continues, has the heartbeat and continues to grow to full term and deliver a new baby. But now, uh, when there is apart from the genetic abnormalities, the other thing that we should be worried about is There can be a few diseases in which there is a placental abnormality, and which I feel those placental abnormalities are there, and hence baby loses his heartbeat. And in those cases, further treatment and investigation is required. Lakshmi, your other question is which trimester is most important? I would like to say, Lakshmi, all the three trimesters are important. The time you give birth to a baby and you are healthy till 1.5 months post delivery, that is 6 weeks post delivery, all trimesters are very important. So you cannot neglect any of these care during any of the three trimesters. What week is okay to give birth? After 37 weeks, if a baby is born, Lakshmi, then the baby is mature lung wise and the baby is in good weight at that time and the baby is ready to survive in this new world and it does not need mother's womb anymore. Now, I've answered the question to Lakshmi that what time week is okay to give birth. If 37 weeks is fair enough. Between 37 to 40 weeks, if a patient delivers, it's fine. Now, Lakshmi, again the same question: which trimester is important and why does a heart stop beating? I've already answered. All trimesters are important, and for a heart to stop beating, there are many reasons which cannot be listed out just now, but a few are genetic abnormalities of the baby, which is the first and very important reason. And the second reason is placental abnormality in the baby with which the placenta is growing. The third is if the mother has any severe illness during this time period. Bhavna Anadgan, your question is how accurate is a double marker test? Double marker test is accurate by 70%. So now your question is what is the meaning of low risk in double marker test? The meaning of low risk in double marker test means practically the test is negative and the chances of the mother bearing a baby with trisomy 21 or 18 or any little defect is very, very low. Durga, your question is what is the age risk in a double marker test? Okay. Your age risk, uh, the age risk in double marker test, if we go to see, as I said, as the age moves from 30s to between the 30 to 40, as higher the age, there are more chances of patient having genetically abnormal baby. Age risk if we consider for 35 years, it is 1 into 30 or to 50. It is out of 250 pregnancies, there are chances that one pregnancy is double a patient having that trisomy 21, that is the baby having syndrome. Is double marker test compulsory? Yes, Madhvi, if monitoring issues are not there. And if the age of the patient is more than 32 years, then and if the nuclear transmission shows more than 3.2 mm thickness, if there is a history of previous baby born with Down syndrome, then yes, double marker test becomes compulsory. Can we feel a baby's heartbeat by touching their stomach? Sorry, Divya, we cannot feel the baby's heartbeat by touching their stomach, but we can feel the baby's movement by touching the stomach. Divya, but can you feel a baby heartbeat at 2 months? Divya, you cannot feel baby's heartbeat at 2 months. In fact, you cannot feel baby's heartbeat during any trimesters or any period of pregnancy. And definitely, if you are having your first pregnancy after 24 weeks, second or third pregnancy after 18, 20 weeks, you can feel the movement of a live baby inside you. Maybe your question is it normal to not hear the heartbeat at 12 weeks? If the baby's heartbeat are not you heard at 12 weeks by a simple machine to measure the heartbeats, then a sonography is suggested. If there is heartbeats are there in sonography, nothing to worry. But if the baby at 12 does not have heartbeat, it is a dead baby and it needs to be delivered. Bringing your question is what happens if there is no heartbeat at 15 weeks scan? If there is no heartbeat at 15 weeks scan, you need to terminate the pregnancy. You need to deliver the baby. Hi, Doctor. Jenny, good afternoon. Hi, Doctor. Can you tell me tips to stay healthy throughout my pregnancy? Jenny, definitely. For staying healthy throughout the pregnancy, the most important is the changes in your lifestyle. Your lifestyle is healthy, pregnancy automatically moves out food. So you need to improve your diet habits, do some exercise, do some yoga and mental relaxation, remain stress free, eat healthy food, and your pregnancy is perfect. Take the medicines prescribed by your doctor. Do all the tests on time, do regular visits with your doctor, and your pregnancy sails swiftly throughout the period. How what can be done to get rid of back pain? Jenny, most back pain in a pregnancy is postural because of the increase in lumbar lordosis, that is the back moving a bit in front. The patient is standing. Lordosis, it is the reason of back pain, and the other is calcium deficiency. So start taking calcium tablets. You can apply any gel, painkiller gel on the back. You can take hot water fermentation, back care exercises. You can do back care exercises during this period. Jimmy, what are the important tests to be done? Probably I've answered all the tests in my lecture. Once again, repeating it, I would like to say that tests that needs to be done are complete blood count, the blood group, sugar report, the thyroid report of the patient, the triple act, respiratory BCG, HCV, and VDR. These are the viral markers to be done. Routine micro examination need to be done. Double marker or quadruple marker test. Double marker between 11 to 30 weeks, quadruple marker between 15 to 20 weeks. A glucose tolerance test between 28 to 30 weeks to see whether the patient is going on for the gestational diabetes or not. These are a few important tests to be done during pregnancy. So, I've been justifying my topic. Probably I have a few more questions. You can just put it in the chat box and I will answer. And summarizing the story of Downs of double marker test. It is a test to be done between 11 to 13 weeks pregnancy in patients whose age is more than 32, who already have a child with Down syndrome, who have conceived after test tube baby treatment is IVF treatment. These whose nuclear translucency, there is so no scan showing nuclear translucency more than 3.2 mm. All such patients are high risk and they need further investigation going for a double marker test. Double marker test is a simple blood test measuring two hormones HCG and FA. If the test is positive, you need to further go in for invasive testing of the baby, coronary sampling or amniocentesis. And if it turns out to be negative or low risk, then need to remain cool and calm and safely sail through the pregnancy. Thank you very much for being with me on this live show on BabyChakra. I would like to talk. If you want any questions, ask me. My consultation on BabyChakra is available with the ID of KAVS, and you can open my page and see my history. Ask the questions. I'll be available to answer these questions on the app of BabyChakra. Do not download the app, download it as soon as possible. Thank you for your patience, dear friends.